Cerebral palsy is an umbrella term for a fairly diverse group of neurological disorders caused by a non-progressive brain injury or malformation that occurs before or soon after a child is born. With cerebral palsy, the brain is affected, which can manifest itself in various symptoms, but mostly body movements and muscle coordination are affected. Other symptoms of cerebral palsy include problems with speech, impaired sensitivity, vision and hearing, as well as an epileptic syndrome. The social significance of cerebral palsy lies in the fact that this pathology is one of the leading causes of disability in children. Cerebral palsy affects the development and formation of muscles, which in turn, in the process of active growth of the bones of the skeleton, leads to the formation of joint contractures, subluxations and dislocations in the hip joint, bone deformation. Formation of spine deformation. The mechanisms of the development of such orthopedic complications are insufficiently studied. Among the important reasons are structural and functional disorders of muscles, spasticity, reduction in the length of the muscle belly, smaller diameter of muscle fibers and changes in the sarcomeric apparatus of myocytes, and disorders of their innervation in the form of paresis of some muscle groups and spasticity of others. Each child with a diagnosis of cerebral palsy has unique features and manifestations of orthopedic complications associated with the main diagnosis. Therefore, the plan of surgical treatment is individual for each patient and is created on the basis of the analysis of clinical and radiological research data, taking into account age level according to the system of classification of large motor functions and complaints of the patient and family. Indications for surgical treatment are rigid contractures of the large joints of the lower limbs, hip, knee, ankle joints, which sharply impair the ability to stand independently or with assistance and walk, and make it difficult to perform hygienic care of the child. Treatment of rigid muscle contractures of the joints consists in performing tenotomies, open or percutaneous, minimally invasive fibromyotomies or plastic lengthening of tendons. A mandatory condition for a positive stable result is the use of orthotics and physical rehabilitation treatment in the form of stretching. Verticalization in the postoperative period to prevent recurrence of contractures and quick and more complete recovery of the patient. The modern standard of treatment for children with cerebral palsy is the performance of single-target multi-level surgical interventions performed simultaneously on all pathologically altered segments, muscles or joints. This tactic, if performed correctly, can significantly improve the results of surgical treatment and reduce the rehabilitation period in children with cerebral palsy. The approach to the treatment of foot deformities in children with cerebral palsy consists in the use of minimally invasive techniques aimed at stabilizing the shape of the foot in the early stages of the formation of the deformity, which allows preventing the further progression of the foot deformity. Among spinal deformities in children with cerebral palsy, scoliosis is most often noted, which is diagnosed in 20% of children with cerebral palsy and develops in almost 100% of children who have limited mobility and spend most of their time in bed or in a cart. It is also known that patients with tetraplegia have an increased risk of developing scoliotic spinal deformity. Diagnosis of spinal deformities is carried out using an X-ray examination of the spine. The development of scoliosis in children with cerebral palsy has its own characteristics, which differ from the standard development of idiopathic scoliosis, namely, in cerebral palsy, scoliosis progresses more quickly, orthosis of such deformities is less effective and complicated. Complex scoliotic deformities sometimes require surgical treatment.